Okay, so we are going to do a very extensive review for the final. I may even ask you guys, just kind of throw out some questions here and there, just kind of making sure you understand the key points of each topic. Please make sure that you understand that the final will be 100 questions, multiple choice. It will be the same format that we've been doing all term, okay, so it will be on eCollege. What I will do, and I will do this for all sections, I will also have a printed copy of the exam for those of you who need to just kind of write out your answers and just kind of get your bearings of writing things out, and I will have colored pencils. But please make sure that you put your final answer on eCollege, okay? So even though you have a printed version just to kind of write as much as you like, I will allow that for the final. Also for the final, I will give you guys a little bit of an extended time. Remember that we're really supposed to have like 1 minute per question, which means we'll have 100 questions, 100 minutes, but I will take it to 120 minutes, okay, for you guys. So you can just have that extra time, okay. The format will be, again, multiple choice, a lot of NCLEX style questions. As you know, it's no secret, I do use at least 2 to 3 NCLEX books where I get questions from, okay? So you will have straight NCLEX questions on the test. The other thing that I'm going to add in are some case study type questions, okay? I did have time to kind of write some things out, and what I mean by case study questions, I will have a case study written, okay, about a particular patient and what have you, with possibly some laboratory values, maybe a picture, a lot of information as far as like clinical findings and things of that nature. And then there will be a series of questions that go along with that case study, okay? So maybe about 3 to 4 questions for that case study. So just to kind of give you a heads up with that. Pictures. So as you know, in eCollege, all the pictures are posted. And we will also review the laboratory values just to make sure that everyone has the correct thing highlighted, okay, that you should be going over. And that's that. Once you're done with the final, as you know, your grade will be given to you right away. And that's that. Again, with the final, I will be triple checking myself, and then I will also have, again, the NCLEX specialist proofread the exam just to make sure that there are no errors as far as questions are concerned, so we don't have to go back after and, you know, kind of figure out if there are any issues. Yes?
Are you going to include a lot of questions with multiple answers?
Yes. So those are the NCLEX style questions. So the NCLEX style questions are going to be the ones. Well, not all of them, I'm sorry, not all of them are multiple answer, but yes, I will have multiple answer questions. Now, how many, I don't know, okay? The other thing with the 100 questions, some people say, oh, are you going to focus on more information after the midterm and not as much as before? I would like to try to make it even, okay? So I'm trying my best, and it's kind of hard because there's more information with cardiovascular and respiratory. So if I would say what's going to be more of the highlight of the final, and not to say just focus on only those chapters, but I would say there's more information with cardiovascular and respiratory, okay? Keep in mind, cardiovascular system was split up, I think, into like 4 chapters, okay? Going with blood disorders and shock and cardiac issues and when we talked about arteriosclerosis and all those things. So there was a lot of information with the cardiovascular system, okay? Which we'll go over today, but just to kind of give you a heads up with that if you, I would say there's a bulk of questions with that information. The NCLEX style questions, please make sure that you read them carefully. As you know, these questions are not just science questions. They're more, okay, well, the client has X, Y, and Z, and what would you do if the patient states blah, 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 or what would you expect the patient to say, okay, things like that. So not only do you have to know the information as far as the pathogenesis and everything about the disease process, but making sure you know how to put it in a format with a patient, okay, and how to interact with it, I should say. that's that. Am I missing anything? No. Now, first thing I just want to go over, pictures and laboratory values. You are responsible for all the pictures that we've gone over so far in this course, okay? Please keep in mind that the pictures will be included in case study type questions, so I will, I could have just a plain picture maybe saying what is this maybe associated with, but most of the time, just kind of looking back, I did write most of the final already, just to let you know. So just kind of looking back and remembering the final, most of those pictures are associated with questions, okay? So make sure you know, what I mean by that is make sure you know, okay, if you see a picture, what the disease process associated with it, okay? So what are the signs and symptoms of the patient, much like when we went over leukemias, okay, where you had to know all the information, okay, behind that picture. So just kind of go through that. The only new pictures that I added in, which you guys had on today's test, was the reproductive disorders, okay? So make sure that you go over, and I believe those pictures are in your book. I don't have them posted on eCollege, but it's the same picture that's in your book. I can try to find it from the publisher and post it. But those pictures are just the different placements of the uterus, uterine positions. And then I think I also told you to go over the pictures with the uterine prolapse. Okay, so those are the only new pictures that you're responsible for. Okay, so all the pictures. Now, if you have your laboratory value sheet, let's go over that now. And I want you to, I just want to confirm that you have all of the things that you should have highlighted. Okay. Now again, I'll say this, I said it to you guys, but I need to say this for the video, for the students that are watching the video from the other sections. I am not adding in new information. The only new information that I will be adding in is just basic knowledge that you guys already know about diabetes. And so this is why I'm going to go over the laboratory values to make sure, because I am also incorporating glucose testing, okay? That is extremely important to know, not only just by itself, but also when we go over those cardiovascular disorders, okay, and how that relates to diabetes. Okay, now, the first page we have, please make sure you have highlighted platelet count. Red blood cell count, whole blood. You should also have highlighted white blood cell count, whole blood, and white blood cell count differential. Okay. Now, I just want to stop there for a second, and again, I'm taking my time with this so to get you prepared. How do you think I could use the white blood cell count differential in a question? As far as the percentages of each different type of white blood cell. Somebody said it. Somebody said leukemias. Okay, so for the leukemias, okay, keep in mind that when we talk about the leukemias and we talk about having immature blast, okay, for those acute type of leukemias, that these percentages will come into play, okay? So when we talk about a percentage, maybe something that's like a 60% of neutrophils or immature, maybe 60% immature neutrophils, okay? That's how that differential may be used. What's another way a differential blood count can be used with the different types of white blood cells? Well, not so much bone marrow, well, a little more deeper than that. So they do come from the bone marrow, but each one of those white blood cells have a function.
But for infection?
Very good, for infections. Okay, so please keep that in mind that I can use a white blood cell differential count for infections. So say for example, someone's having a parasitic infection, or they're having maybe, say for example, when we talk about patients that have asthma, okay, having a high eosinophil rate, okay, which we know. So keep in mind that that's how we're going to incorporate that type of blood work, okay. Okay, so I think that's that for the first page. The other ones we know. Okay. Now for the second page of your blood work with the laboratory sheet, I did add in, I don't know if I told you guys, but I'm adding in arterial blood gas assessment. Do you have that highlighted? No. So I'm adding in arterial blood gas assessment. It's at the bottom of the second page, which is page 487 of the laboratory value sheet. So the second page of it is towards the bottom. Okay. So what I need you to highlight, carbon dioxide partial pressure. I need you to also highlight oxygen partial pressure. I also want you to know oxygen saturation and pH of whole blood, which you probably know that already. Now we're not going to go into the effects of altitude and sea level and 8,000 feet and all that. We're not concerned about that. Now, why would we look at arterial blood gas assessment? For what conditions? More respiratory than cardiovascular. Although if it is a cardiovascular issue, that could be associated with respiratory. Okay. But yes, for respiratory issues. Okay. So this can go for not only our obstructive but also restrictive. Okay, respiratory diseases. So just make sure you know when we would be using those. Okay, so that's that for that page. Now the next page, I do want you guys to know the lipid panel. Okay, so make sure you go over the lipid panel, and I think we had that highlighted already. Yeah. Yes. Okay. So just to confirm, cholesterol, HDL, LDL, and triglycerides. Now I'm only holding you accountable for the desirable levels. Okay, so just to let you know, you don't have to get into very high risk and moderate and so forth. But I'll just hold you responsible just for the desirable levels. Now HDLs, they do have a difference in men and women, so please just kind of pay attention to that at least. But other than that, you're just responsible for desirable levels. Yes.
The triglycerides as well?
Triglycerides, yes. Also triglycerides. So when would a lipid panel be used? In what conditions? Cardiovascular conditions. In particular, which one? Cardiovascular conditions, that's probably associated with what? Hypertension. Could be hypertension, very good, and very good, atherosclerosis. Okay, atherosclerosis and hypertension. And usually what happens, the atherosclerosis could be causing the hypertension. Okay. Now, the next page you have is the cardiac biomarkers at the top. Okay, so that's the third page, the fourth page, page 489. Page 489, so at the top you have your cardiac biomarkers. You are responsible for knowing the CK serum, CKMB, and also troponin. Okay, so CK, CKMB, and troponin. Now we all know when would we use this? Heart attack. Okay, so not only heart attack, but let's just say the term, what we call acute coronary syndrome. Okay, So this type of testing would be done in an acute coronary syndrome to see what the levels are. And then from there, if the person's having a heart attack, then you could label what type of heart attack they're having. Okay. Now, the other thing on this page I do need you to know is the blood clotting assessment, which I believe we also highlighted so far. So the blood clotting assessment for the INR, I am holding you responsible for making sure you know that 1.0 is in healthy individuals not receiving anticoagulant therapy. Did I tell you to highlight anything else?
The DBT.
Oh, okay, and I did tell you DBT, okay. So make sure you know 1.0 for healthy individuals, and then DBT 2.5. Okay, so the ideal target for warfarin prophylactic treatment is 2.5 for those people that have a DBT, treatment for DBT. Now, partial thromboblasting time, APTT, you should know that, and also PT time. Okay. Now, towards the bottom, I'm adding in another set of laboratory values here, and this goes along with people that do have glucose issues, okay, or I should say diabetes. So, glucose serum fasting, I do want you to highlight that. Glucose 2-hour postprandial blood, which is after a meal. Postprandial is after a meal. So glucose 2 hours postprandial. And then the last one I need you to highlight is the glycosylated hemoglobin. And they give you a percentage for that. Now, the reason why we have to know the glycosylated hemoglobin is because when people do have glucose levels, or high glucose levels, that glucose gets traveled in the bloodstream and it does attach to the hemoglobin, okay? And that is a way that it can be tested, so we'll know, okay, exactly what's going on with that patient. And that's actually a very good form of testing for diabetes. Now, yes?
I'm sorry, is that the test known as the hemoglobin A1C?
Yes, yes, that is the same, hemoglobin A1C. So the abbreviation is there. I will try to make sure on the test that I'll have the whole thing written out, okay, in the abbreviation so there's no confusion, okay. But just make sure you look at the abbreviations as well, okay. When you're, but yes, that is, thank you, the HB A1C, okay. Now, this is the new information that I'm adding in, which is not a big to-do, okay. With diabetes, if I have a case study with a person with diabetes and they have this type of blood work done and, you know, their levels, okay, are maybe indicative of them having diabetes. A person that has diabetes, that can predispose them to what types of issues? Hypertension, very good. So please keep in mind, and I believe I had a question like this on, I don't know if it was the second test or the third test, but keep in mind that if you have a patient that has maybe cardiovascular issues, there's a couple of screenings that should be done. One screening, yes, you would look at anything that has to do with cardiac markers or anything like that. You should also look at, obviously, a regular CBC with diff. But you should also look at if they have any type of glucose issues, okay? A glucose testing should also be done. Keep in mind, glucose testing should be done because what you want to see here is that if this patient has diabetes, and if the diabetes is not controlled, this can now cause them to have hypertension and have uncontrolled hypertension because of the diabetes, okay? Those things kind of go hand in hand. Okay, that's all right. I'll go back to that. Okay, so that's it for that page. And I think that was it. You guys are getting it a little easy because next term I'm going to make them memorize pretty much the whole thing. So, Now, what will happen is those laboratory values that you guys are memorizing so far, believe it or not, you're going to see it again when you get into Nursing 101. Okay, so it'll be the same information that that we have here. Okay, although their ranges may be a little different, that's why. But it's pretty much the same. Okay, so we're okay with the laboratory values. Okay, so make sure that you memorize all your laboratory values. Again, this is why I will allow you guys to, I will give you paper, or for those of you who have an actual printed test, I would advise you as soon as you get to your test, turn it over, don't even look at anything yet, don't look at any questions, and just write out all the laboratory values that you have memorized. Okay, so that way when you get to the question, it's right there. You have your little, what they call crib sheet, a cheat sheet. But we don't want to say cheat, but a crib sheet to help you out. Okay, now, week 1. Week 1, we went over chapters 1. Let me just take all my information out here. Chapters 1, 4, and 7. Okay, 1, 4, and 7. With chapter 1, keep in mind that that chapter was just basic terminology, basic introduction, okay, to pathophysiology. A couple of things I do want you to focus on with this chapter. Please make sure you know the categories as far as etiology, risk factor, pathogenesis, and treatment. Okay, and I think we all know that by now. Please make sure you also know the difference between a sign and a symptom. And make sure you know the difference between the SOAP format, S-O-A-P. Okay, so if you remember, S stands for subjective findings, O stands for objective, A is for assessment, and P is for plan. Make sure you know that basic terminology. Why? How am I going to use this? I could have a full case study question, okay, about whatever it is, and I could ask a question as far as, okay, well, what part is the risk factor, what part's of pathogenesis, subjective, whatever, okay? And then go into, obviously, all the other details, okay, or other questions that could be associated with that case study. Okay, so we know that, and that's pretty basic information. Okay. Also focus on levels of prevention, which was in chapter 1, levels of prevention. Okay, so levels of prevention, we have primary, secondary, tertiary, okay. Do you remember, or could maybe give me an example? What's a good example of, let's say, a secondary level of prevention, if you remember from week 1?
Annual screening.
Very good. Any type of annual screening, okay? And this is a very good way of adding in, say, if we want to tie this into neoplasias, okay? This includes annual screenings, so let's just say breast examination, maybe prostate exam, testicular exams. Any type of follow-up visits also fall under this category as well, okay? Vaccines is more primary. Vaccination is more primary prevention, because with primary prevention, we want to decrease the susceptibility of other people getting it, okay, with primary. Whereas secondary is just more of like early detection or follow-up or management of the disease, okay? So I think you guys got that down. All right. Okay, so that's chapter 1. Now, chapter 4 went over cell injury. Okay, so we talked about the difference in reversible and irreversible cell injury. Okay. Now, can you tell me a couple of different examples of what is called a reversible cell injury? Very good. Hydrophic swelling is one. That's actually the most common type of reversible cell injury. Okay. hydrophic swelling. And what is the issue with hydrophic swelling? Okay, so the sodium-potassium pumps are not functioning. Okay, so this is the reason why it makes the cells swell, fill up with water, okay, and cause this type of injury to the cell. Now, what are some other types of injuries that can happen? Some other examples. Inside the cell, not outside. Very good. Intracellular accumulation, so keep in mind that sometimes the cell can fill up with different types of material. Okay, so intracellular accumulations, where when we have intracellular accumulations, this cannot, this causes an issue. So the example I gave you with intracellular accumulations was fatty liver. Remember I explained that process with people that are alcoholics. And keep in mind that liver is, one of the functions is to help break down, okay, some of the cholesterol and fat. And so what happens here is that that takes secondary to the alcohol. They're trying to break it down, so then they have a fatty liver. What are some other things that go along, or what are some other examples, I should say, of reversible cell injury? There was a whole chart with a couple examples. I'm sorry, I'm picking your brain so early.
Ingestion of material.
Very good. Okay, ingestion of indigestible materials. Okay, so sometimes the cell can now accumulate indigestible materials that cannot be broken down. A very good example of that type of cellular injury that we've gone over, okay, in a previous, or I should say a more recent disease process, is in respiratory diseases, when we went over occupational lung diseases, okay. Keep in mind with occupational lung diseases, this is a very good example of this type of cell injury, where these individuals inhale coal particles, silica, asbestos, or whatever it is that they're inhaling, and then this now causes that type of damage to the cell. Reason why I'm going over this in this much detail is because I want you guys to understand and tie in the type of cell injury to the type of diseases, okay? So with this final, this is now pulling it all together, okay? Now the other ones, just to let you know, just to kind of hurry up with this, is if for some reason there's a problem with DNA, okay, where DNA can now form different mutations of the cell, and also if we don't have enough enzymes, okay, or if there's a deficiency in the enzymes, which we know a very good example is obviously some of the GI disorders, okay, that we've gone over. Okay, now cellular adaptation. Okay, so we all know the different forms of cellular adaptation. So we have atrophy, hypertrophy, hyperplasia, and dysplasia. Oh, and metaplasia, I'm sorry, thank you, and metaplasia. Okay. Give me an example of atrophy.
Or muscle atrophy.
Okay, yes, muscle atrophy. Well, yeah, well, I don't want to go with osteoporosis, but yes, muscle atrophy. Muscle atrophy, okay, very good. So if, for example, patients in a hospital bed, okay, in intensive care or whatever, and they're there for a long period of time, yes, muscle atrophy could happen, okay. What is another example of, let's say, hypertrophy? Working out, so we have, that is considered what we call physiological hypertrophy. So if you go in and you work on your skeletal muscles and they get larger, okay, so that's physiological hypertrophy. What's a good example of a pathophysiological hypertrophy? Okay, so say for example, vascular flow is not where it should be, okay, or let's just say cardiac output is low. And so what the heart rate is going to do is increase. When the heart rate increases, it makes the heart pump faster, therefore making the heart larger, Okay, so that's a very good example of pathophysiological hypertrophy. Now, what's a good example of hyperplasia? Callus formation, which I do have a picture of, so keep in mind that this is an increase of cells due to mitotic division. There's another hyperplasia that I think we went over. Oh, what's another, is a very good example of hyperplasia that we just went over last week? It's reproductive system. Okay, very good. BPH, benign prostatic hyperplasia. Very good. Benign prostatic hyperplasia. Okay, so that's right in the name there. Okay, BPH. I think, was it on your test today? I think it was on your test. I thought there was a question of BPH. Okay. It was, right? Yeah, it was. I thought it was. Don't forget. Okay. Okay. Now, the next one is metaplasia. What's a good example of metaplasia? I think we have a lot of examples with that. Some diseases we've gone over quite a bit of. Okay. Okay, so in the lungs, keep in mind that a person can have a metaplasia, especially when we talk about smokers, okay? And I explained that whole thing, how it burns out the cilia and all that. What else? What's another example of metaplasia? Some diseases that we've gone over in class, because I actually have. Very good, Barrett's esophagus. Barrett's esophagus. And yes, there are some lung diseases that do have a metaplasia. I think there are two restrictive pulmonary diseases that have the cellular adaptation and metaplasia. I can't remember the two right now. But the point of me saying that is when you're studying your diseases, please make sure that you highlight, if you see a cellular adaptation within that disease, highlight it please, because I will have questions like that. So I may have a question, okay, well, which of the following diseases have a metaplasia? Which of the following diseases are hyperplasia as far as the cellular adaptation is concerned? So just make sure you kind of make a separate chart or group them together however you want to study, okay? Make sure you know that. Now, dysplasia is pretty simple. What is it now when we have a dysplasia? What is this saying? Precancerous, okay, so this is precancerous, and please make sure you know that when a dysplasia occurs, that this is a disorderly appearance of the cells. You can't tell what it is, and usually, just to kind of let you know the way it follows, if there is a metaplasia, that is something, yes, that should be looked at because it could lead to a dysplasia. Not saying that it will always lead to a dysplasia, but you want to make sure that it doesn't and have that followed up. Yes.
Can you just say what's the difference between dysplasia and neoplasia? So they're both kind of like.
Okay, dysplasia is precancerous, meaning that you'll see disorderly cells and then you'll see normal cells. And then with the cancer, with the neoplasia, it's the whole tissue is you just see more cancerous cells.